seem, they've actually been around for centuries. The U.S. military has long enacted vaccine mandates, beginning with the Revolutionary War, when colonial soldiers were falling ill from smallpox, hindering their ability to defeat the British. In 1777, George Washington ordered everyone in the Continental Army who had not been infected to be vaccinated. The mass inoculation was the first organized program of its kind, and many historians argue helped the U.S. defeat the British. In 1971, new military trainees were required to take 2 vaccines to fight against adenovirus infections that caused acute respiratory illness. And in the 1990s, U.S. military personnel had to get an anthrax vaccine. Those who refused the vaccine could be demoted, discharged, or even imprisoned. Schools have also been mandating vaccines for centuries. In 1855, Massachusetts passed the first U.S. law mandating vaccination for school children to prevent smallpox transmission. In 1905, the Supreme Court ruled that state police powers include the right to preserve public health, and therefore states could enact universal vaccine mandates. This was despite the Constitution's 14th Amendment protecting individual civil liberties. By 1922, more and more states started to enact vaccine requirements for school children, but not without controversy. In 1944, Prince v. Massachusetts established limits on parental authority. States could intervene in cases where parents or guardians are abusive or irresponsible, like, say, when denying their children vaccines. During the measles outbreak of the 1970s, states that had measles vaccination laws in schools had measles incidence rates 40 to 51% lower than states without those laws. Today, all 50 states have laws requiring vaccines for students, but with 3 exemptions: medical, religious, and philosophical. All 50 states have adopted medical exemptions for children with health risks from vaccines. 44 states and Washington, D.C. allow vaccine refusal on religious grounds. Philosophical exemptions exist in 15 states, allowing individuals to object based on personal or moral beliefs. While states have broad powers to enact vaccine mandates, they also have the powers to block them and can bar employer vaccine mandates, school vaccine mandates, or vaccine passports.